Well, from South Asia now to South America, where the virus is also, of course, surging. As Rafael Romo shows us, doctors and nurses in Uruguay are being pushed to the limit.
Intensive care unit Dr. Monica Lotti says some patients are hard to forget. It's hard to cope with what I've seen. I can't get it out of my mind, she says. Lotti works at one of the main hospitals in Montevideo, Uruguay's capital. The country is now dealing with a new wave of COVID-19 cases, and even though these doctors say they try their best, the survival rate at this hospital is not very encouraging. 80% of those with a ventilator die, he says. The mortality rate for those without one is 50%. For most of April, Uruguay, a country of 3.5 million, had the highest infection rate in the world and still remains near the top. And according to the Uruguayan Intensive Care Unit Medical Association, ICU admissions tripled in the last month. This situation forced hospitals, both public and private, to increase the number of beds equipped with ventilators by 23% in an effort to avoid a collapse. After working long shifts and days off for months, only one word can describe how health professionals feel.
Abrumada.
Overwhelmed, she says. That's the word. If there's a sliver of good news, is that all of these doctors and nurses, as well as those in charge of maintenance and cleaning, are fully vaccinated. But that doesn't make their jobs any easier, especially, they say, because their work entails walking a very fine line between life and death. Life outside these ICU walls is also getting increasingly harder to live, Dr. Lotti says. It always takes me a while to realize that I am no longer here and to embrace my life outside the hospital, she says. Once out of the hospital, nurses and doctors at this ICU say something that especially bothers them is the fact that many people fail to realize that the pandemic is not yet over, crowding parks, shopping centers, and stores that have reopened. It's two different worlds, she says. People seem to be oblivious to our reality inside the hospital. Sometimes I wish people would come here and walk in our shoes so that they understand what's really going on, this ICU nurse says. According to the Pan American Health Organization, 1 in 4 global deaths from the virus has occurred in the Americas. Uruguay, together with Peru, Bolivia, and Argentina, have reported a sharp rise in infections. Back at the intensive care unit, doctors and nurses remain focused on saving lives. They keep on trying their best because they know some of these patients may not be here when they return tomorrow. Rafael Romo, CNN.